It's a Northwest News Radio weekend. IRG's Health Talk continues.
All right, it's time for our first guest. Actually, guests. Lauren Pelster, occupational therapist, and Lisa Wood, a physical therapy assistant at IRG Cascade's Children's Therapy in Mill Creek. And they're going to talk about some of the services this group offers, Shannon.
Yeah, we're super excited to have Cascade Children's Therapy as part of our service platform. This allows us to take care of the population from pediatrics to geriatrics. And at Cascade, they do specialization in treatment for pediatric speech, physical therapy, and occupational therapy. Very gifted, very skilled, and a very important treatment for kids that need help.
All right, Shannon O'Kelly, Lauren Pelster, and Lisa Wood.
Lauren and Lisa, welcome to Health Talk. How are you today?
Great. Doing good. Thank you. How are you?
Both excited to talk about the very special services that you both provide there at Cascade Children's Therapy there in Mill Creek. Lauren, you're an occupational therapist, and Lisa, you're a physical therapy assistant. This is Cascade Children's Therapy in Mill Creek, specializing in treatment of various pediatric issues. But I want to talk to you both about how you got interested, because believe me, as a physical therapist all my life, I appreciate what you all do so much and the specialization and the training you have. Tell our listeners what you each do and how you got interested in pediatric therapy. How about that?
Yeah. So this is Lauren. I became interested in pediatric OT. I used to volunteer for children's camps in the summer with children with disabilities, and just found a love for helping children to play and learn and do the things that they need to do to develop.
That's great. Lisa, how about yourself?
Before becoming a PTA, I taught yoga, and I was a professional dancer for a while. And I've always honestly loved working with children, the honesty and just how willing they are to play. And I was lucky enough to be able to do a short internship here at Cascade Children's Therapy under the previous owners. And then I became lucky enough to get a job here.
Yeah, I want people to understand, when you talk about treating pediatric patients, and this is a child from, 6 months, 3 months, 4 months to 18 years of age. Is that pretty accurate?
Yep. From birth to 18. Yeah. That sounds right.
Yeah. Well, yeah. It's interesting because as a parent, when your child who wasn't communicating got sick and you knew something was wrong, it's very stressful. Mm-hmm. But you can't ask a baby, at 6 months, like, well, how are you feeling? What are you doing? And when I watch you people work with those young kids, it's amazing. How do you learn to pick up? How do you pick up what they're doing, what they need? How do you get them? What are red flags? All these things that you do, but they don't communicate. They're just moving, and you're reading that movement. So tell us about that.
Yeah. Just creating a connection with them and knowing and kind of getting their perspective on how they're feeling. So, when they're crying, something's wrong, you need to figure it out. But also talking with your doctor to see some red flags on how they're developing, their muscle tone, or whether they're meeting their developmental milestones, either fine motor, gross motor, speech. Those are some red flags to look out for, and definitely talking with your doctor about it. Yeah,
the OT work that you do and the PT work, how would our listeners differentiate between what is the OT doing and what is the PT doing? I know you work as a team, including speech, but what's each of your emphasis?
So OT, we focus on sensory processing as a huge part of what we do for pediatrics. So sensory processing is how we interpret and organize the sensory information we get every day. And some kids either are hypersensitive or hyposensitive, so they can't do their daily things as a typical child would do. We also work on the fine motor and gross motor skills that you need to get dressed, draw shapes, color, brush your teeth. And then physical therapy is the gross motor.
With physical therapy, we work on, if your child is a toe walker, we're going to get them to walk with more of that heel-toe gait pattern. We're going to work on the strength. A lot of strengthening of the legs. Can your child squat? I have cerebral palsy patients, ataxic patients, low tone or, low muscle tone. And how can I help those children be able to move better through life and maybe do, hopefully get to the point where they can do some of the fun things that all kids want to do.
Back with Shannon, Lauren, and Lisa after this timeout on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
We continue our conversation with Lauren Pelster and Lisa Wood and Shannon O'Kelly.
Talking to Lauren, OT, and Lisa, physical therapy assistant from IRG Cascade Children's Therapy Services in Mill Creek. We're talking about pediatric, PTOT, and speech therapy. Maybe talk to our listeners about maybe your typical kids that maybe you would see. I know things like autism, but you see a lot of different things in the pediatric population. Maybe you can tell us some of the diagnoses you treat.
So some of the diagnoses I treat, children with cerebral palsy, Down syndrome, toe walking. We do also, and we have more autism for sure, and babies who were born with torticollis. Mm-hmm. I'll let you talk with Lauren for a moment about what you. Some hemiplegia or cerebral palsy, autism, any sensory processing difficulties, fine motor or gross motor delays.
It's interesting as a parent, I remember, you're watching your child and it's like, oh no, they're not progressing along that developmental sequence, right? I think sometimes we worry a lot as parents, and rightfully so. And I think sometimes the media picking up something or getting on the internet and Googling something can be frightening, right? Yeah.
Yes.
But here's what I want to just make sure I recognize here. You guys have so much compassion and so much care, and you can just hear it when talking to you about how you care for these little ones. But it's just not the little ones that are here, right? If you are a parent and you have a child that is born with cerebral palsy, Down syndrome, autism, changes your life. It changes your life.
Yes.
What's cool, and I've seen you guys do this, but you're not just treating the child, you're calming the family down. It's going to be okay. And, this child it really still is a gift, right? Tell us about getting the family involved.
Yeah, totally. Just helping the parents to helping them accept and to work through these challenges that, they're helping their child work through. We help them to be able to do the things at home that they can implement at home so they can continue the progress outside of the clinic, and so that they can, go out into the community and kind of just keep developing.
And if I can just add on, I just look at it like almost like you're building a little puzzle. Like if this child, say, falls a lot, right? Mm-hmm. So what am I going to do to help the child strengthen the legs? Like any other physical therapy, what are going to be simple home exercises that the family can do with the child at home to now strengthen this child and, get them to balance better. And then it helps the whole family when that child falls less, right?
Yeah, absolutely. Absolutely. And just the comforting. When parents come in, you can see the little progress that you're making and the progress the child might be making. It changes lives. And as we wrap up here, I just want to give you two ladies a big shout out. We are so excited and so glad that the first this year of 2022, IRG is become partner with Cascade Children's Therapy, and we're so happy that you're part of our family, can now provide care to the family from pediatrics to geriatrics. So you're a big part of IRG, and thank you for coming on the radio with us.
Thank you.
Thank you so much for having us.
Shannon, this sounds like another great addition to the IRG family here with the Cascade Children's Therapy, which offers pediatric development and can really help a lot of children in a lot of ways.
Oh, they can help in so many ways. Just comforting for families. Like I mentioned, we were talking, just the family support, the education, the teaching, the instructing, just the calming effect that if you're a parent and your child has some kind of special need or developmental delayed, it's just comforting to be able to have resources like these folks provide at Cascade Children's Therapy Services in Mill Creek there.
We continue our show right after this time out on Northwest News Radio.